Hi, this is Mayor Warren with the Warren Report. I am reporting from home. I have a very special guest today. It is my wife of 21 years. She is a first responder, a medical professional. She is a mother, a wife, a community servant, and someone who has some understanding of this coronavirus outbreak and what the community is trying to do to combat it. Dr. Carmen Warren, welcome. First of all, what do you do? Why are you here? What's happening?
So you said it earlier, I'm a frontliner. I work at a hospital down in Newark, New Jersey. I'm in the emergency department, so I see the effects, and I see COVID is what it is. Coronavirus just means all the viruses under corona.
Okay.
And I see the effects of COVID-19 every day.
How long have you been practicing? What is your specialty area? Where'd you go to school?
Undergrad, I went to Tuskegee University in Alabama. I majored in electrical engineering, and I was an electrical engineer. But then I went back to medical school, and I went in New Brunswick, Piscataway, to Robert Wood Johnson Medical School under Rutgers. And I did my residency for emergency medicine in Newark at Newark Beth Israel. And I've been at University Hospital for about 14 years now. Actually, 16 years, 14 years, one else. In the emergency department, and I'm a specialist in emergency medicine.
You're also on faculty. You teach there as well?
I also teach students and residents. I'm an assistant professor of emergency medicine.
And you belong to a number of organizations where you also serve on health committees dealing with public health. Is that correct?
Yeah. So I'm also a member, the vice president of the Essex County of the Links Incorporated organization. I'm also a member of Delta Sigma Theta Sorority Incorporated.
And you serve this town. You volunteered as one of the medical professionals when we had the Part 1 of football teams and some of the high school games.
Yes, that's something I enjoy doing. That's been a while, but yes, I used to do that.
I have some questions here for you that people just commonly ask about on a regular basis about this coronavirus, and I want to go through some of them with you. So many people are scared, and if they're looking for symptoms, what should they look for?
So it's okay to be afraid. It is scary. I mean, it's scary because you see the effects that are happening to a lot of people. But for the most part, the majority of people, 80%, will do fine. And so one of the things that everybody tends to have is cough, fever, feeling very weak, tired. Some may also have nausea, some diarrhea. But those are the symptoms that mostly everybody we see has. The majority, at least 80 to 85%, will do just fine. It's just like a flu. I mean, if you've had the flu, you almost feel like death. I mean, it feels horrible. So, I mean, in the same way, coronavirus itself can range anywhere from the common flu all the way to where it becomes worse, what we call the COVID-19. They're different strains.
Now, while people may recover, and we try to report a recovery rate when I do my reports, what are some of the things that are hindering recovery?
So, although 80 to 85% of people will just be fine, have limited amount of symptoms, the one that we are concerned about is when you start to have problems breathing, and when your oxygen level is a little low. And one of the ways to learn about that or to look for that is signs that it looks like somebody's having trouble breathing. Also, if their face starts to look what we call ashen, a little gray, lips a little blue, that's when you want to start heading to the emergency department to get help. Otherwise, we are really asking people to stay at home, self-quarantine, because the other symptoms are there. You can't change them. And it's nothing that we're going to do for you in the emergency department with that.
And if I come to the emergency department and I have those symptoms, is there medicine I need to take? Is it just me staying home and self-quarantining and allow it to subside? Or what is there any magic bullet to eradicating this COVID-19?
Well, there's two things that you're saying. So if you're having the generic symptoms of fever, cough, body ache, diarrhea, nausea, yes, stay at home, self-quarantine, take Tylenol for your fever, relax, stay away from family members. But if you are at home with all the family members, everybody needs to stay in the house and nobody needs to come out. But when you start to have the symptoms where you're short of breath, You can't function, you can't move from one room to the next room without really getting really short of breath. That's when you come to the emergency department. At home, it's just Tylenol.
Okay. What do we know in the medical community about person-to-person transmission of the virus?
So I think we're learning day to day more about the virus. Currently, right now, we know that people can walk around and have the virus and not show any symptoms. It's what we call asymptomatic or pre-symptomatic, which those who have the coronavirus are doing just fine. And that's why we're begging people to stay at home. Because you're walking around and you're not showing symptoms does not mean that you can't give it to somebody else, right? And so being in the same vicinity of somebody, whether you're coughing, sneezing, even if talking, sometimes you can also give the virus to somebody else who cannot handle the virus like you can. So you seem to be doing fine, but you give it to grandma and grandma can't fight it like you can. That's why we really need you to stay in the house.
Does age matter? Does gender matter? Does race matter in who's more susceptible to the virus?
So there is no age, there is no race that are more susceptible than the others. What it is that the way that you fight it will become, well, actually, the way that you fight it is based on sometimes your age. Your age will hinder how well you do if you do catch it. Some of your underlying diseases that you have, such as asthma, heart disease, diabetes, those patients will tend not to do as well. Does not mean they won't do well, does not mean they'll die, just means that they will not do as well. The expectancy is not that they will do as well as those who don't have that. In addition, you'll find a lot more people of African American descent that have the numbers of doing that well, and that's just because of social determinants of health. I mean, for the most part, you'll find that the African American community has more of the underlying health problems. They are living in more dwellings where more people are in one room together. They have the jobs they can't stay at home and isolate and quarantine. They have to go to work. The economics, they don't have the best health care, so they haven't been taking care of themselves all along, and then when they get sick, they're not necessarily going to the hospital. So you'll find that the numbers for the African American community are much higher than those who don't.
How can we combat the spread of the virus? Is the mask something that we should be doing? Are the gloves working? Should we be spraying down and wiping down?
Well, currently, I mean, our own governor has said and is begging you to stay at home. That is the key, staying at home. But we also do ask you to wash your hands. When you wash your hands with soap and water, you should be doing that no less than 20 seconds. We also ask you to wipe things down with alcohol-based products. They should be at least 70% alcohol, 60 to 70% alcohol, and also your bleach products. I know a lot of people are nervous. They go to the store, they come home, they wash the bags and so forth. That's not recommended, but if you feel more comfortable to do that, then do that. The biggest thing is wash your own hands. Keep your hands clean on a regular basis, and that's what we're begging people to do more often than we are to say worry about cleaning your products.
I have a pet. Is my pet susceptible to the virus? Can I keep my pet in the home? How should we be dealing with our home pets?
Well, I mean, everybody knows that recently there was a tiger that was found to be positive for coronavirus. There's no statistics out now that say that you can catch the coronavirus from your pet. But again, if you want to be around your pet and wash your hands again, everything falls back to you taking care of yourself and washing your hands. So keep your pet clean, keep your hands clean, and then also take care of yourself.
If you're in our generation, in our 30s, are we invincible? Can we not get it because we're so young?
You know, it's so funny because I right before this breakout really became big, I was in Jamaica, and you could hear people saying, "Oh, we don't get it because either I'm young or I'm black." Those are all fallacies. There is no discrimination of who gets the virus, and so we've got people as young as 6 all the way to as old as 80, 90 with the virus. So there is no discrimination of age. There's no discrimination of race. What is key is making sure that those who have underlying medical conditions, that you're staying away from them and that they're at home and isolating.
If you can give us just a general view of the medical profession and resources, do you feel that we're prepared to continue to fight this? Is there anything that you recommend that we do? What can we do in the public to contribute to the lengthening of the resources of the medical profession?
Well, I mean, there's obviously a shortage countrywide, nationwide. When you think about it, right? If there's a epidemic or something that happens, it usually can happen locally, epidemic-wise, or regionally. But when it happens nationwide, it's like a big surge all at once. So the system was not ready to handle such a thing to happen at one time. So you're looking at every area needing the same things, needing ventilators, needing masks. We're all needing this personal protective equipment all at one time, which is called PPE. At the same time, everybody else hears the same things, whether it's the medications, whether it's I need masks. We all run to the stores and we grab it. You need to just keep your masks, regular procedure. You can even use your clothing, cover yourself. Leave the protective equipment for us. We need it. We need it more than you need it. We need you to stay at home, keep your hands clean away from your face, wash it on a regular basis, wash your clothes, keep yourself clean at home while we take care of it on the front line. So we are the ones that need the protective masks, the ventilators to take care of you.
Well said. You're also a mom, you're a wife, and when you leave taking care of the world, you still come home and take care of the family. How do you do it? I know your husband likes to eat a lot. He likes home cooked meals. He likes to have a clean house, and he's not the best cook in the world.
No.
How do you do all of that?
I do the same thing that I'm telling you. I go to work. I make sure when I come, before I leave the hospital, I clean my clothes. I wipe it down with certain wipes. Make sure by the time I get in my car, I wipe my car down. I have gloves on. I have my mask on. I get in my car. By the time I get home, I take my clothes off immediately. I spray it down with Lysol, throw it in my washing machine, and I go straight to the shower and I wash with soap and water. Make sure that I'm clean, make sure that I'm cleaning everything, my hair, and then I go to bed because I only work the night shift. When I get up, clean again, cook, make sure that both my husband and my daughter who's home from college understand the importance of making sure that their hands are clean constantly. I have a husband who's constantly on the go and talking to people, so I try to make sure that he understands, along with you all, how important it is about non-contact and social isolation, well, distancing.
Tell me about your kids. Tell me about our kids.
What do you mean tell you?
Where are they? Are they back home from school? Are their lives disrupted?
My son is a junior at Howard. He's off campus, so he's in his apartment. He understands he's not to go anywhere. He's taking his classes. My daughter's home from school. She's also a freshman at Harvard, and so she's taking her classes at home and on the computer, but she understands too about social distancing. And I know it's hard, even for kids. I mean, I've had, from the time Nia came home, it was, oh, well, can I just meet so-and-so? It'll just be the two of us. No, absolutely not.
So you shut all of her social activities down?
Stay at home. Stay at home.
Wow. And you even resorted to ordering from New Jersey for your son's groceries in Washington, D.C.
Yes, I did not want him to have to go to the store, walk around, anything like that.
Super mom, super wife, and a super public servant, Dr. Karma Warren, I'm proud to say, is my wife of 21 years. Just wanted to give us an inside view of what's happening in the medical profession. Doctor, any last words on what we can do to prevent and what you would like to see in terms of research to get this COVID-19 out of our lives forever?
I don't think it's ever going to be out of our lives forever. I think the more we continue to do research and find ways to, like we did vaccine when the flu was a pandemic back then, this is just the new flu. So research will start to look for ways that they can attack this virus, whether it's by a vaccine, whether it's by doing an antiviral medication. So I just continue to hope that they're continuing to work on that and make it happen. I think what I would just ask is that you stay at home, stay at home, stay at home. Keep those hands clean, wash them as much as you can. If you have to go out, which I know some of us have to, make sure you have your surgical mask or a procedure mask, something across your face, because it does reduce the amount of transmission. Exercise as you can. I know you may not have to do, the biggest workout, kickboxing or anything like that, but I ask that a strong heart keeps you from getting more worse. I also ask that you eat healthy. I don't know how many people are taking multivitamins a day, but I would take multivitamins. I mean, make sure that that's part of it. So wash your hands, social distancing, keeping away from those 6 feet, eat healthy, exercise, and take your vitamins.
There you have it, the doctor's orders. This is the Warren Report. We hope that all the information we bring to you is helpful and helps us to continue to fight this COVID-19. Please do all you can to stay home, keep
Stay
your
home.
distance, wear your mask, wear your gloves, and remember, together we can beat the coronavirus. If you want to reach out to the mayor, 862-373-0025. That's Mayor Dwayne Warren at 862-373-0025. Of course, if you need meals, if you want to eat healthy like the doctor said, contact 973-280-1621. That is the mayor's hotline. The doctors also asked me to put up the toll-free number to call the CDC for the coronavirus hotline for the state and for the CDC. You'll see that up on your screen. Make sure, and this is going to come in another version of our show, that people who don't have access, do not let the lack of a language be a barrier to getting treatment. We have to make sure that when we print any informational, that it be done in both languages, and certainly the numbers that we're going to give will allow you to look at information in various languages. Yeah. Thank you all. God bless during this Easter season. We hope your family stays well.
Here's how you can make your own face covering in a few easy steps with items you can find around the house, like an old scarf, a bandana or a hand towel, or you can make a face covering out of an old t-shirt. Fold it to the middle from the bottom, fold it to the middle from the top, fold it again to the middle from the bottom, and again from the top, and then 2 rubber bands, one on one side and one on the other side. Then you fold either side to the middle, and you have yourself cloth face covering. It's that easy.